Prior to starting to monitor the patient's respiratory function, we need to do two things. The first thing is we need to place the monitors onto the patient's chest. One goes on the right chest, just below the third rib, in a manner like this. And the second one goes just below the epigastrium, just below the xiphisternum. That's the xiphisternum, so we place the second one there. So now we have two separate devices which monitor the patient's movement of the chest and the abdomen together. Now that we've placed the two monitors on the patient, we need to calibrate the system and ask the system to start to work. And so we see a period of bizarre tracings on the monitor, the blue showing the chest and the purple showing the abdomen. And after a short period of calibration, we'll see that the system settles down into stable waveforms, which show how the patient is breathing, inspiration and expiration. And there we can see how the waveforms have stabilized. The upper blue, the chest, the lower, the abdomen. And if we look at the monitor, we see that the patient is breathing 19 breaths per minute, and there are no abnormal breathing events. We will now create an abnormal breathing event by just asking the patient to stop breathing. And so we'll see how the waveforms go from a sinusoidal format to a straight line. And we see now that the respiratory rate is 19, and it will drop to no breathing, which will show us up in red that the patient is no longer breathing. And so we see the two lines parallel to each other. There's one abnormal breathing event and no breathing. Now ask our patient to continue breathing, normal tidal volume, inspiration and expiration. And we see once again just how the monitor is sensitive to show the fact that the breathing pattern resumes normal format, and the patient is now breathing 13 breaths per minute. Patients who have respiratory distress usually become tachypneic and increase their respiratory rate. So we'll ask our patient now to increase his respiratory rate, and we'll see on the monitor how this takes place. It starts at 17 and slowly will work its way up as the patient breathes faster and faster. And so we see that the response time is fairly rapid. He's now at 25 breaths per minute and going up. We'll now ask our patient to breathe normally at a normal respiratory rate. And so we'll see how the waveforms slow down and the respiratory rate will drop back down to the normal values around 12 to 15. Once again, we'll ask our patient to become apneic and not breathe, and we'll see how the waveforms flatten out and show simple non-breathing pattern of two parallel lines. Now wait for this to show no breathing. And we have no breathing and two events, the first of apnea and now a second event of apnea. The patient will now breathe once again normally. And the sinusoidal format will return. Now we'll ask our patient to breathe, but to try and breathe as slowly as possible that he can. And so we'll watch how the breathing rate goes down and the respiratory rate numbers go down. Just breathe slowly, please. Slowly the respiratory rate comes down. Now we see a predefined that when the patient drops lower than 12 breaths per minute, it shows up in red. Respiratory rate was 11, and now the patient's gone back to breathing normal breathing. The last thing that we'll do is we'll ask the patient to take a deep breath and to expire all the air in his lungs so that we can see the forced vital capacity. And there we see the curves go up and down. And now don't breathe. If you can hold your breath for a minute and become apneic, and we'll see how the parallel lines resume. That then are a few of the functions that we can see looking at the respiratory monitor of BreatheVision.